I'll turn it over to Dr. Clayton.
Thank you. Good morning, everyone. We are reporting 37 new COVID-19 cases this morning. This does include 14 new hospitalizations. We have 0 new deaths to report. We have 31 new individuals who have recovered from COVID-19 and 259 new negative tests that have been performed. In total, we have 2,668 COVID-19 cases in the state. This does include 817 individuals who are considered to have active infections, as well as 1,830 that are considered recovered. A total of 211 hospitalizations have occurred, as well as 21 deaths. 16,045 total negative tests have been performed to date. For the community impact map, we have Beadle County moving from minimal to moderate to no community spread. Clay County is being moved from no community spread to minimal to moderate activity. And Union County is being moved from minimal to moderate to substantial community spread. Our cases by county include 6 in Brown, 1 in Coddington, 1 in Lincoln, 28 in Minnehaha, and 1 in Union. For the cases by age range, we have 3 in the 0 to 19-year age category, 7 in the 20 to 29-year age category, 9 in the 30 to 39-year age category, 7 in the 40 to 49-year age category, 5 in the 50 to 59-year age category, 4 in the 60 to 69-year age category, 1 in the 70 to 79-year age category, and 1 in the 80 and older category. For cases by sex, we have 24 males and 13 females.
All right, I'll go ahead and unmute the lines and we'll take your questions. All right, we're ready for your questions. We'll take our first question.
Jeremy Kugelberg, Forum News Service.
Go ahead, Jeremy.
Just 2 questions on well, 3 of the updates of the big new places that we know. So Smithfield, what the latest numbers are there, Demcoda, and then if you can, the Good Samaritan facility in Sioux Falls.
For Smithfield, we have no new updates. For Demcoda, we are now reporting 41 cases, and that was the last that you had asked about, Jeremy?
The Good Sam facility in Sioux Falls.
Okay. For Good Sam, I'll have to grab that data. We're looking at over just about 90 total cases within Good Samaritan. That includes both staff and residents.
Okay, thank you.
Hello, can you hear me?
Yes, go ahead.
Okay, I'm sorry, Scott Waltman, up at the American News in Aberdeen. And I just was checking on the Demcoda, I guess, are the 41 cases all employees? And I mean, I'm wondering when that, or if that total has crossed into a more concerning or alarming phase at this stage, I guess.
So, yes, that we are reporting out only those cases that are associated as employees of the Demcoda Beef, and I would say that a single case within a business is concerning. That we do work with both businesses that have had increasing number of cases, but we also work with businesses as quickly as possible when they have their first case identified. That's part of the information that our staff are providing when we're conducting the active case investigation. We're also reaching out to the business to notify them of an employee that has tested positive, and so we do treat even a single case in the business as very concerning.
you have a feel for whether that number is ready to plateau, or is there any way to tell that, or peak, or start the downward trend?
That is not something that, we know, and that would be more speculative than anything.
Next question.
Morning, JP at KRN News Radio.
Go ahead.
Thank you very much. I see that there is a second drive-through COVID testing site in Sioux Falls open this morning. Seems to be a lot of traffic there. With the number of increased tests over there, do you think that we'll see more positive cases?
So I think anytime you're testing more people, there's the likelihood that you're going to find additional cases that were either asymptomatic or mildly symptomatic, and this testing event also does include individuals who might be currently experiencing symptoms. So I think it's a great way of helping support the community and making sure that we're identifying cases, and we do anticipate and are planning for staffing so that we can take care of any of those new cases that are identified.
Thank you.
Next question.
Hi, this is Todd Epp at Kello.com News in Sioux Falls.
Go ahead, Todd.
I have a couple of questions here, so bear with me for a minute. So when this all began, and the governor and Secretary MALSAM-RYSDON and Mayor Tenhaken and others started talking about this, we talked about flattening the curve. I want to go back in history a little bit. If we didn't flatten the curve, it's my understanding we would have X number of cases. If we did flatten the curve, we would have X number of cases. They would just be spread out over time. Is that a correct statement of the situation, of how we understand how this virus was going to spread?
Todd, this is Kim MALSAM-RYSDON. I think that is basically correct. But I do want to just reiterate that, our planning has been around ensuring that our healthcare systems in the state and healthcare providers are adequately able and prepared to treat individuals with COVID-19. And so none of our projections have changed around the number of people that are likely to be infected with COVID-19. It's about the timing of that and ensuring that we have appropriate hospital-based resources for folks that will need that.
Okay, so if we did nothing, we were going to have X number of cases, and if we did everything that everyone said we should do, we would have X number of cases. So the only thing we were preventing was an overcapacity issue for the hospitals. Is that right?
Yes, that's correct.
Okay,
that's the goal of flattening the curve.
Okay, so in this process, we talked about hospitals' capacity to provide medical care. Did anyone look at the hospital's financial capacity to increase their capacity to provide care? Was that part of anybody's calculus in all of this?
So I wouldn't say that we were looking at the balance sheets of hospitals relative to our capacity planning. It was really around, and continues to be around, physical space, staffing, equipment, and ensuring that folks have, the supplies and other things that they need.
So South Dakota workers and businesses have had to bear the brunt of this instead of the hospitals investing in more capacity to take care of these coronavirus cases.
Well, Todd, I think if you were to talk to some folks associated with the hospitals, they would tell you about the financial implications that they've had because, of course, they haven't been providing non-COVID health care either. And so they've experienced financial distress because of that.
Okay, and I don't mean to be mean about this, so why am I wearing a mask? Why am I socially distancing? and why are many other South Dakotans doing that, including businesses closing, if all this is going to do is push this down further this spring or summer? Why not just get it over with right now, and then we can bring the economy back faster?
So last question in this line, but it's important that people take responsibility for keeping themselves healthy, as well as protecting other vulnerable people, in particular, who could have very, very serious outcomes from being infected with COVID. So we still strongly suggest that people practice social distancing, good hand hygiene, wear a mask if you're out in public, limit your group sizes. That will help keep individuals healthy in our state.
Next questioner.
Thank you, Madam Secretary.
You're welcome.
Josh, Dakota News Now.
Go ahead, Dakota News Now.
Hey, so some quick math shows that our latest positive testing rate to be around 12%. How does that compare to earlier positive case rates, and how does it compare to the national average, or at least other states in our region?
Yeah, so I mean, definitely we're seeing, around that, 11 to 13% positivity rate, I think, as a generality. That does put us, up there in terms of some of our surrounding states, in terms of our number of positive cases per million, when you look at it as a total number of all of our current cases. But we are also, very high among our neighboring states in terms of the number of tests that we have performed per million as well. So what I would say is that, if you're going to conduct testing, then you do need to expect to find those positive cases, and that's reflected in our testing volumes and testing numbers.
Next question. Final call for a question. All right, thank you all for joining us today.